Welcome to this learning unit on digital tools in clinical reasoning. In this video, we will explore 5 categories of digital health technologies identified through the D-CREDO project. These categories represent different types of digital tools, where digital transformation meets clinical reasoning, shaping how future clinicians think, decide, and learn. The 5 categories of digital tools you can see here reflect an integrated view of clinical reasoning. They combine perceptual, cognitive, and contextual dimensions of decision-making. In each category, we will see how these tools influence how information is perceived, processed, and acted upon in clinical settings. Let's look at each in detail. Artificial intelligence in image analysis, particularly deep learning models such as neural networks, can play an important role in clinical reasoning. They assist with the interpretation and diagnosis of medical images. AI in image analysis offers several important advantages by supporting faster and more accurate interpretation of medical images. These tools extend human perceptual capabilities by recognizing subtle or complex patterns in medical data that may be difficult to detect with the human eye. And they highlight and draw attention to the most relevant image features, guiding clinical focus and improving diagnostic confidence. AI tools are powerful, but they come with important challenges. Clinicians may develop automation bias, trusting AI outputs too readily. Many models lack explainability, making it difficult to understand how results are produced. Their transferability is limited because models trained on specific datasets may not perform well with data from different populations or image conditions. That's why critical human oversight remains essential in every AI-supported decision. You as a health professional must learn to interpret AI-assisted outputs within a reflective and contextualized reasoning framework. This aligns with the theory of distributed cognition, emphasizing an active partnership between human judgment and artificial intelligence. Large language models and big data tools analyze large amounts of text and data to support clinical reasoning. They provide new pathways for synthesizing medical information and supporting hypothesis generation. Large language models and big data tools offer several advantages in clinical reasoning. They can summarize large amounts of data, reducing the cognitive workload for clinicians and students. These tools integrate evidence from many sources, supporting informed decision-making. They can suggest possible diagnoses and draft notes or letters, saving time in clinical documentation. Used thoughtfully, they can make clinical work more efficient and data-driven. Despite these advantages, these tools also pose ethical challenges. There are privacy concerns related to how patient information is stored and used. These tools can reflect or even amplify biases found in their training data. They may also produce hallucinations, information that sounds correct, but is actually not based on any evidence. Because of these risks, all outputs from such tools must be checked carefully and interpreted critically. When using LLMs, it is important that you as a health professional engage reflectively rather than rely uncritically on AI-generated suggestions. Learn to verify and contextualize all AI outputs as part of your clinical reasoning. mHealth apps and wearable devices provide new opportunities for patient care by incorporating real-time, patient-generated data, often collected outside traditional clinical settings. This offers unprecedented opportunities for distant, personalized, and continuous care. By continuous monitoring, they can show long-term trends, detect anomalies, and by that, enable proactive and early interventions. They work outside traditional clinical settings and through that extend observation beyond the clinic walls. However, clinical reasoning is essential for interpreting such data. Is the data transmitted by these tools reliable and correct? Is the data incomplete or missing? It is also important to consider patients' digital literacy and their ability to use these tools correctly and consistently. Finally, the design of these tools must make sure that data privacy and security are always protected to ensure the patient's safety and trust. You as health professionals will have to integrate these monitoring tools critically, ensuring that monitored data enhances rather than complicates the clinical reasoning process. Electronic health records and clinical decision support systems provide access to comprehensive medical information, along with automated warnings, reminders, medical calculators, and evidence-based recommendations. They have redefined how clinicians access and interpret patient information. In their role as central data tools, they offer central access to comprehensive patient information, helping clinicians see the full picture of care. By supporting information sharing and continuity of care, they connect healthcare professionals across teams and settings. They also assist with reminders, alerts, recommendations, and simple calculations, improving accuracy and efficiency in clinical decision-making. EHRs and CDSS also present several practical challenges. Poor usability can lead to information overload and make tools difficult to navigate. Frequent pop-up messages may cause alert fatigue, reducing clinicians' attention to important warnings. Data errors can spread easily through copy and paste or outdated entries. Finally, interoperability issues between tools can limit information sharing and the continuity of care. Effective use therefore requires technical proficiency from you as a health professional. You need to manage the information complexity within the EHR and evaluate CDSS recommendations critically before integrating them into your reasoning process. Telehealth extends clinical reasoning into virtual spaces. It opens the possibility of delivering healthcare services and care through digital communication. It allows continuity of patient care when patient and health professional are not at the same place. It has become essential in situations where face-to-face encounters are limited or impossible, such as during pandemics, natural disasters, or military conflicts. By facilitating virtual consultations, telehealth supports interprofessional collaboration and patient-centered decision-making, even at a distance. However, telehealth environments may require significant adaptations in data acquisition and interpretation, as direct physical examination is limited and important non-verbal cues may be missed. Clinicians must develop new diagnostic and communication strategies, learning to rely more on patient self-reporting, digital images, and remote monitoring data. Building trust and empathy through a screen can also be difficult and require strong communication skills. You as healthcare professionals must therefore make careful decisions about when telehealth is appropriate and develop new strategies for diagnostic reasoning and relationship building in digital contexts. Your reflective practice is crucial to maintain empathy, accuracy, and professional judgment as clinical reasoning becomes distributed across digital communication channels. Each of the digital tool categories we talked about represents a different dimension of augmentation in clinical reasoning. Their effective use depends not only on technical proficiency, but also on reflective and ethical competence. The list of digital health tools that support clinical reasoning selected by the D-CREDO project is by no means exhaustive. Other potential technologies such as virtual reality, virtual human twins, or telerobotics may also play a role in the future of patient care. Digital tools should be viewed as collaborators in reasoning, supporting, challenging, and expanding human judgment rather than substituting for it. As you continue your professional development, consider how each digital tool you encounter shapes your clinical reasoning and decision making. By combining digital literacy with critical reflection, you can use these technologies to deliver care that is both evidence-based and human.